Hello and welcome to this ISNTD Festival session that will be looking at journalism and the very important role of journalists and the field in communicating about science and more specifically neglected tropical diseases and the communities that are affected by these 23 diseases. It's been a pleasure to host the festival, the ISNTD Festival, all of today and with another day coming tomorrow. This brings together, as many of you will know if you've been here for most of the day, all things creative together, bringing that together with the field of neglected tropical diseases and infectious diseases, and really exploring the ways in which we can communicate about NTDs and those working in this field and communities that are affected. So a really exciting day, and it's my pleasure to welcome our speakers for this final session of day one. Some are journalists, some are scientists, academics, also organizations working very hard to bring together the media, the journalism side, and the health and medical side. So I'm sure you'll all be joining me to welcome very warmly our speakers today. And we will be hearing first and foremost from Dr. Trust Matsilele. Welcome and thank you for joining us today.
Thank you.
Dr. Matsilele, you're Senior Lecturer in Journalism at the Birmingham City University. You'll be talking to us about funding roadblocks, knowledge gaps, and also the future of science journalism in Southern Africa. So thank you for setting the scene for us. We will then also hear from Aline Tavares. Welcome and thanks, Aline, for joining us. Hi, you're very lucky to be joining us in Brazil. I'm very envious. You're a Senior Communications Analyst at the Instituto Butantan. Welcome and thank you so much for being here. We will also hear from Ricardo Carrillo Meza. Ricardo, welcome.
Hello, thank you.
You are with the Health Sciences Center at the Autonomous University of Baja, California, in Mexicali. Thank you. And we also have on the call a journalist tuning in from Nigeria, Adenike Adebowale-Tambe. Welcome, Adenike.
You sure your audio is on?
Is on. Oh, we can hear you. I'm not sure you can hear us right now, but I know you're working on that. So in the next few minutes, we'll have you connected on the call. And representing the Internews Health Journalism Network, it's my pleasure to welcome you, Kathryn Cleary. Hello, thank you for being with us today. We have a lot of different perspectives and a lot of different issues to talk about and think about when it comes to how to best communicate about diseases, scientific research in this field with a broad and varied audience. So without any further delay, I'd love to hand over the floor to you, Trust, to talk to us a bit about trends in journalism in Southern Africa as you've reported and seen in your research.
So first, thank you for inviting me to be part of this important discussion. I do not need to rehash what you have already spoken. Yeah, I teach at Birmingham City University in the journalism program. So my reflections will probably draw from two of the studies that I have done and were published recently. One looks at the concept of environmental funded journalism, and I'm reflecting on this because of the convergences that you find between environmental reporting and science reporting. In fact, there's all this ongoing tension between these two fields. And if you try and look for some definitional aspects, you find that most of journalists that you talk to, when you ask them, what is science journalist, they probably end up defining this concept the same. So part of their engagements with scientists or researchers like myself, you find that they reflect more on their experience of science through the prism of environment. And the second paper is the one that speaks more specifically on influenced journalism practice when you look at the whole concept of science reporting in Southern African context. So the paper, especially the one on science reporting, focused on South Africa, Mozambique, and Zimbabwe. These countries, they faced, especially in the recent memory, a lot of these science-related challenges that find more expression in part because of El Nino and drought that took place sometime in 2020, 2021, or before that. And then, of course, the issues of COVID pandemic also accelerated some of these health challenges. I think maybe to just indicate from the word go is that the challenge, especially in these three countries, is this over-reliance on overseas development aid, which is a challenge in part because especially when you look at issues around tropical diseases or these neglected tropical diseases, that they are not at the global agenda. It's of either these donor agencies that try to look at some of these neglected diseases, and even it doesn't appear in the global agenda. So you can imagine even ability to understand and report on these diseases that are neglected for most of journalists within Southern Africa, becomes a challenge, right? Because most of them are not even trained. They don't have the skills to report on science, and let alone science around neglected diseases. And of course, maybe the other aspect is that you are dealing with neglected populations in most of these cases, which again exacerbate the idea of knowledge challenges that you face when you look at science reporting and also reporting on issues of tropical diseases. I don't want to waste time, especially talking about definitional aspects, because most of people in this session already know about the whole idea of science journalism. But perhaps just to say in passing that when you look at science reporting, you look at the broader areas of climate change, biological science, geomatics, medicine, and also the emerging field of artificial intelligence. We are not going there in this presentation, but perhaps the whole idea of biological science and maybe peripheral level issues around climate change because of its related aspects when you think about issues of neglected populations. So what are the macro challenges that are facing the sub-region, but also reporting in this field? You can think around issues of climate change as one of the major issues facing this region. And with that, in the past few years, there has been an experiencing of these El Ninos that also come with some of the diseases, not necessarily neglected diseases, but also some of the diseases that some of the neglected populations face in this sub-region. COVID, also one of the things that this region has been facing, and also issues around weak health infrastructure. I think what has happened in part because of El Ninos and also COVID-19, it has exposed the weaknesses of the health infrastructure within the regions. And people who suffer the most whenever there's these macro shocks, especially at the health level, are neglected populations, in part because some of these populations live right at the periphery of either of the country capitals where people have access to health delivery, but also they're at the periphery of political will. Politicians, in most cases, don't really prioritize these populations because they don't bring either economic capital or political capital or even social capital. So because of that, they are neglected. But also maybe the other element is that they're also neglected by the media, in part because of the political economy of the media. Media try to give a lot of attention to these hegemonic populations, and these populations are seldom the neglected populations. So when there's a crisis, media will likely report only on populations that are at the center of political power or economic power or social power. But when you think about these neglected populations that are at the periphery, they seldom get attention. And because of that, also media doesn't find it necessary economically to give attention to these populations. So our methodological consideration, especially for the study that was looking at science reporting, we interviewed a number of journalists from Zimbabwe, Mozambique, and South Africa. And what we're trying to do is to get journalists that are at a mid-level, that are called usually mid-career journalists. They will have like moderately between median number was around 7 years within the media organizations. But of course, some of the media organizations, because of the political economy and some of the shocks that have happened in the recent history, some of the media organizations really are run by young, entry-level journalists. So in cases, for example, that you see with Cape Times in South Africa, you will end up interviewing someone who is asked to write sometimes on science with just 3 years of experience. So our samples was ranging from 3 to around 13 years of experience in the industry. And we were focusing mainly on leading media organizations, which are like the mainstream in out of this country. So in South Africa, it will be News 24, which is part of the Media 24 group, which is the largest media group in South Africa. And we also did Cape Times and Cape Argus, which are also owned by the third largest media conglomerate, which is called Independent News and Media. And then in Zimbabwe, we focused on Alpha Holdings, which is the biggest independent media in Zimbabwe, and also Zim Papers, which is government owned. And the same with Mozambique. We went for Not Class and Akara de Mozambique, which are also, trying to focus on journalists who are working for these mainstream media organizations. So what are the major issues that we found in this study was the issue of political economy of the news ecosystem, that science reporting is largely neglected because, number one, because of the complexity that comes with it, but also it doesn't feed necessarily into the whole idea of newspaper sales, right? It doesn't sell in comparison to other media, genres or media bits like politics, largely politics, maybe second level would be business, right? So science reporting is at the far end if you look at the political economy of the news ecosystem. And also the knowledge gap is another thing that we observed. Most journalists who report on science don't have background in science, and also a lot of media training institutions across these 3 countries don't offer science journalism as a course. So most of the journalists who end up reporting on science is either learning as they go, or you find one journalist who has a passion for science who end up writing. South Africa has one a media organization that is dedicated to health reporting called Bekisisa, but the other countries, Mozambique and Zimbabwe, there's no dedicated media entity that focuses on science reporting. And then the last thing that we observe that I will share just in a moment is the access to scientists. There is 2 levels. Number one, scientists that don't necessarily see the importance of journalists, but also journalists struggle to access knowledge that is produced by scientists, right? Because the academic jargon or language that you find in journals is not easily accessible. So these are the basic findings that we extracted from the study. Limited knowledge, which I've already spoken about, issues around knowledge gap that ran across all 3 countries, Zimbabwe, South Africa, and Mozambique, and also organizational influence, that where you see the allocation of resources, that most of these media entities in all countries, they don't necessarily allocate resources towards science reporting because it doesn't necessarily help generate revenue for these media organizations. There's certainly a preference for political news because political news sell, in comparison to science reporting. The only point where you see science reporting getting attention is when you have these macro shocks like what we saw during a COVID pandemic, and also maybe before in South Africa, we also saw that when there are like sudden that are associated to either some product, some either health products, there was some disease 3-4 years ago that came because of some products that were produced by one of these biggest retail companies. It's only in these moments, but largely ephemeral, where people decide that, okay, maybe we need to bring some more focus in science reporting. Other than that, politics and business takes a major focus. Then you also have a lack of science reporting or investigative skills. I've already made a reference to the idea of knowledge. Most of the journalists don't have training, not the knowledge to report on science, and because of that, that impacts on reporting on science within the region. And maybe the last thing is no specific. There's limited government funding for science reporting development programs. So most of the programs that you see that are funded by the government, in most cases, they are either, like currently, most of the countries are going through election cycles. So there's a lot of investment towards political reporting. There's some investment towards developmental journalism. There's some investment towards climate, but very limited climate reporting, because much of it doesn't necessarily come from the government, but from agencies. So because of these kind of limitations, science reporting end up taking the backbench. Perhaps some of the anecdotes that I thought would be interesting, some of the responses that we got from the interview is when journalists tell you that education and knowledge of science-related issues are important key for their ability to report on science journalism-related issues, but most of journalists do not understand the abstract science related to terms, and they shun away from reporting on these issues. So this was one of the responses from journalists that we interviewed. And then also the issue around routine influences is that the challenge with most of, this is one editor who was commenting that one of the challenges with most of our reporters is that science is not their forte. They only read science journals or reports when they want to write stories. So the absence of routine understanding of science broadly and science reportage as a niche affect their ability to report on science. So a journalist will probably just visit a journal when they are rushed to tell a story of this disease or of that health emergence. And because it's just reading to write a story, their stories, in most cases, they end up lacking nuance. In part, again, because newsrooms, they don't have the luxury of people just investing time to understand some of these science-related topics. Maybe the last anecdote is the idea that science doesn't sell. So this was one of the responses that journalists said, that one of the editors said, journalists rarely write science-related stories because they don't sell. It is rare to have a story, with a science, to have a news angle with a science story. No journalists want to be seen as a mere auxiliary member of the newsroom. More so, there's no effort from the institution to change such attitude. I doubt this field will grow given the attitude that we have. So I think it's because of some of these challenges in science reporting that you find this niche facing some challenges within the journalism sphere, especially in Southern Africa. So the challenges with knowledge, which is what we characterize as knowledge gap, the challenge with funding, which is around the political economy, that a lot of newsrooms, they don't want to invest in resources towards science reporting because it doesn't sell, it doesn't generate revenue. And also the idea of access, right? Accessing this science through journals as a part of a routine practice, just understanding the trends and developments that are happening within the journalism sphere. I think I will stop there and perhaps interact later during the Q&A.
Trust, thank you so much. That was absolutely fascinating. And I'm sure the audience will join me. It being quite a scientific audience, I think it would never cross our minds to think that a science story wouldn't be anything but captivating and important. And it's been really interesting to hear how you've described the journalistic process from that lens, which is not something we might have seen from our perspective. And maybe this will be also added to and supported by the experiences of our other journalists on the call, Aline and Adenike, and also from the perspective of Kathryn at Internews. But thank you so much. That's been really very eye-opening and with many lessons from Southern Africa that can be transposed to other areas, I have no doubt. Thank you. Well, let's hear from Aline Tavares, a journalist working with Instituto Butantan, who will provide us with the perspective from Brazil. Aline, over to you. Thank you.
Hello everyone. Thank you so much, Marianne. Should I just click on the right side?
Yeah.
All right. Can you see the slides?
I can see them. Yeah. And have they come up on your side as well?
Yes, they just appeared to me right now.
Oh, super. Thank you.
Right. Thank you. So, hello everyone. My name is Aline Tavares. I'm a science journalist from Brazil. And I'm very pleased to be here to share a little bit of my experience and mostly to be able to connect with such great specialists in the field. So I'm here to talk about the challenge about scientific journalism. It's just a quick introduction about my experience. Currently, I'm a senior communications analyst at Instituto Butantan, which is the main manufacturer of vaccines and antivenoms here in Brazil. And I previously worked at the communications office of the Biomedical Science Institute of the University of São Paulo. And for these past 6 years, I've covered topics such as infectious diseases like influenza and COVID-19, NTDs such as dengue, chikungunya, and snakebite envenoming, and other topics like vaccination, cancer, and advanced therapies. So why communicate about science? According to a survey of 2,000 people here in Brazil, made in 2019, 73% of the population believe that science and technology bring more benefits than harm or only bring benefits to society. And 86% believe that scientific research is crucial for industry. And globally, the Wellcome Global Monitor 2020 showed that the trust in science rose from 35% in 2018 to 43% by the end of 2020 during the pandemic. And the Wellcome Global Monitor also pointed out that the trust in science between people with less scientific knowledge also increased. On the other hand, another survey of 2,000 young people from 15 to 24 years old here in Brazil pointed out that 70% trust science, but 60% don't know that antibiotics are not effective against viruses, or 25% believe vaccinating children can be dangerous, and 54% think scientists might be overreacting about climate change. So as we can see, there's still a lot of misinformation about science. And one of the main challenges is this, combating fake news, fighting fake news. Misinformation can severely impact public health efforts by causing confusion, creating unnecessary panic, or even undermine trust in health institutions. And even long before the pandemic, we had, for example, the myth about vaccines cause autism, or influenza vaccines can actually make you sick, or during the pandemic, mRNA vaccines will change your DNA. So this fake news about science, about health, can spread really fast through social media, as we've been seeing. And every time a fake news emerges on the internet, people's lives are at risk. Every time someone says they don't believe in vaccines, people's lives are at risk. Diseases that are preventable by vaccination are coming back. And for example, we had eliminated measles here in Brazil, for example, but the disease reemerged in 2019. because the vaccination coverage has dropped. When I was taking a journalism and medicine course back in 2019, when I was in my undergraduate course of journalism, a professor told me information can save lives, and I couldn't agree more. To have accurate and accessible information is essential to have a better public health responses to infectious diseases, to raise awareness to prevent diseases like learning how to eliminate dengue breeding sites, or encouraging people to get vaccinated and showing that vaccines are safe and are important for global health, and empower individuals to make more informed decisions about their health and their well-being. And in that scenario, why science journalism is important? Science journalism is important to fill the gap between the scientific community and the general public, to communicate in an accessible language with evidence-based information, and to combat fake news that can harm people's lives, people's health. And however, communicating complex scientific topics in an accessible way without losing accuracy can be quite challenging. And besides translating the complex content to a more familiar language, it is crucial to carefully verify and consult experts to make sure you have evidence-based information. To write about a scientific research, for example, you need to learn, journalists, you need to learn how to read and interpret an article so you can distinguish what can become news and what cannot, what tones you should use. Or is it a basic research? Is it close to becoming a product, a vaccine, or a therapy? Or is it in the initial state of development? Because you need to be very, very clear when communicating to the public so you don't sensationalize the information. And once you have reliable information, you can build a narrative that is more relatable to the general public. So in order to have an effective communication about science and health, it's important to bring journalists and scientists together on this by encouraging journalists to seek scientific knowledge and to build an honest communication with scientists, to engage in workshops, conferences, or even through social media. And it's also important for scientists to understand that communicating their work to society can help strengthen the public trust in science, raise awareness, and therefore benefit public health. And I think that's what I had to say. Thank you very much for listening, and I'm glad to keep discussing. Thank you.
Thank you very much, Aline. That was a really important, useful insight into what your priorities are as a journalist, particularly in the Brazilian context, where you have had also your own challenges, as we've seen this year in the news with the unprecedented dengue outbreak, and perhaps a lot of misinformation circulating, questions certainly from the public. So that's been really useful. Thank you very much. Let's hear from another journalist now on a different continent. Adenike, it's our pleasure to welcome you. I hope you can hear me, and we did see you come up on screen. And oh, yes, wonderful. Welcome. Hello. So now just we can't hear you, and is
my mic on?
Yes, absolutely. We did it.
Okay.
Yeah.
Good afternoon. I had troubles joining with my laptop, so now I have to resort to my phone. I'm so sorry for any inconvenience.
Not at all. We're sorry. This is meant to be a relaxing experience, and we saw that. Yeah, You really tried with the laptop. Well, thank you very much for being here. And
Thank you.
yeah, we would love to hear your perspective. As a journalist, you've worked on specific neglected tropical diseases. You were very instrumental in bringing NOMA, for example, to life to a broader audience. So it'd be really great to hear your experiences as a journalist reporting on infectious diseases, neglected diseases.
Okay. Thank you so much, Marianne. Thank you to my colleagues and good afternoon from Nigeria. My name is Adenike Adebowale-Tambe. I'm a freelance journalist in Nigeria. I had previously worked with Premium Times for about 7 to 8 years, where I was reporting basically health. So, like Marianne earlier mentioned, I worked on a story on NOMA. That's the major story I've actually worked on neglected tropical disease. And about few weeks after, or few days after, WHO included NOMA on the list of neglected tropical disease. That was towards the end of last year. And we applaud them for that very important step. So basically what I'll be talking about is just from my perspective as a journalist on how to cover neglected tropical disease, raise awareness on neglected tropical diseases, and educate people on neglected tropical disease. So before I go into my notes I have here, I'll just tell you briefly about the story I worked on. So the story followed a 5-year-old girl, Fatsuma, who actually has NOMA and was receiving treatment at a hospital for NOMA. There's this NOMA hospital in Sokoto in northern Nigeria. She was receiving treatment there with other persons, and that was the angle I started my story from. So the story looked at Fatuma's story, her parents' struggles, other persons living with NOMA, stigma and discrimination, and then at that time I was advocating for WHO to actually include it in the list of neglected tropical disease, and which they did about a week or two later. I know that was probably due to my stories and every other journalist around the world working on neglected tropical disease. So how did I do it? Was it easy to do? No, it wasn't easy to do. No work, no good story is actually easy to do, but you have to do it. One of the techniques I use is storytelling, which is the first thing I'm going to tell my colleagues here. You have to master the act of storytelling to actually be able to tell good stories. And how do you do that? Learn to humanize your story. Like I said, my story started from consumer angle because I was trying to make people relate. I was trying to humanize the story so it is relatable to people and know that Fatuma could be anybody's child anywhere in the world, and she is having NOMA. So that way you'll be able to sympathize with her and know the importance of actually tackling this neglected tropical disease called NOMA. I'm focusing on NOMA now, but there are other neglected tropical diseases I'm actually going to mention and the study of my story. So I was able to talk about Fatuma experiences and other people's experiences. That's actually very important when using a storytelling technique to humanize the story. So that was why I took my angle from there. Then also another important thing I factored in is the educational part. Because during my story, I realized that most persons, even before going to the hospital, before being diagnosed of NOMA, they don't know the disease they're suffering. They've just been going about. Some persons say it's witchcraft, just one issue or the other. So, and they are only saying this because they lack adequate knowledge about NOMA. They do not know about this disease. And this is where our role as a journalist comes in. We need to enlighten people about this disease. We need to create awareness. We need to tell people that, okay, this disease, this is it. What are the ways to avoid it? Keep your environment clean. Different ways to actually avoid certain disease. Keep your mouth clean, your water, take clean water, and all of that. So that is where our role as journalists is to actually educate people. This also leads me to awareness creation. And how can we raise awareness as journalists? By using our investigative reporting, feature articles. It could even just be an interview with a person living with NOMA or with an health expert. Actually, you can speak with an health expert to come up with a story or a feature you can publish on your website for people to actually get adequate knowledge on it. Another way we can also raise awareness is through multimedia content. We can do multimedia content. Like during my story then, when I was doing the normal story, I also did videos so that people see it, people know the damage normal causes to people's faces, to its victims' faces. So that was what I actually do. As journalists, we have to be advocates, and these are different ways that we can do it. Another way is to communicate with this, like a community engagement with some of these rural communities. For instance, in Nigeria, most places where this neglected tropical disease actually rampant are rural communities. So as journalists, we could just take our time, either we're willing to do a story or not, go to these communities, engage with them, create like a, I don't know, maybe like once in 2 weeks, like I just want to visit you guys, know what you're doing, how you keeping your environment clean, how you keeping yourself clean. With that kind of communication with the rural community, they will learn things from you that they can practice in their everyday life. So I wouldn't say my story was told without any challenges. I had challenges, and one of it was limited access to information. There are not much information about Noma in Nigeria, and even in most African countries. There are no information about Noma. There are no information about neglected tropical disease, and this also affects other health issues too. Data are really, really limited. So that was a major challenge I actually had. But how was I able to overcome them? I was able to rely on WHO and few other health agencies to gather data I could get. But even in my story, I was able to indicate that this data are actually backdated, not recent, but we are hoping same things still apply as the government or generally have not really done much to actually mitigate the impact of these diseases. Also, the issue of stigma and misconceptions. When it comes to neglected diseases, there are a lot of stigma, there are a lot of stereotypes about this. And that was why, even when I was speaking to some of the victims of Noma, then it was difficult for them to speak. I think there was one person, Usman, that told me he had to leave his community for a while because of the stigmatization. So this relies on us journalists to actually shed light on these topics to keep people enlightened on it. And also limited funding. It will shock you to know that I actually used my money to work on that story, and I'm based in Abuja, a really far place to Sokoto, where the center of my story was. It was far, but I'm quite passionate about reporting human angle stories, stories someone nobody else has reported, or stories that have not been overflogged, stories that people need to know about. I'm really passionate about it, and I go to any length to get it done. And I'm happy actually to have been able to be part of the success of Norma being included in the list of neglected tropical disease. So that's basically all. But aside Norma, there are other neglected tropical disease where journalists can look at. We have the lymphatic filariasis. I hope I pronounced it well. Lymphatic filariasis. We have leprosy. We have leishmaniasis, and even Norma. Even for my colleagues in Nigeria, we had a discussion the other day, and I told them that aside the fact that I've reported on Norma, we still need to do more reporting on it. There is not too much reporting on health issues. We need to keep talking about it. We need to keep advocating for increased funding. We need to keep advocating for increased attention to health issues. So that is basically all. I'll be here to respond to any questions from my colleagues and other persons in the house. Thank you very much.
Thank you so much, Adenike. That was an amazing perspective. You're really showing us as well how journalists not only report on an issue, but can sometimes become quite the champion for that issue. You've pointed out to lack of knowledge and need for further awareness building. And it feels like this is a cause that has become very close to your heart as well. That's the important role of journalists and communicators in really endorsing their cause. Thank you very much for that. We're going to swap now to the scientist's viewpoint, and it's my pleasure to welcome you, Ricardo Carrillo Meza. You're going to talk to us, hello, and you're going to talk to us a little bit more about your perspective as a scientist engaging with journalism, what's missing, what's important. So over to you, Ricardo. Thank you.
Okay. Can you hear me?
Yeah, absolutely.
Okay. Good afternoon. I'm Dr. Ricardo Carrillo, physician and immunology and anatomy professor from the Health Sciences Center of the Autonomous University of Baja California, or UABC, at Mexico. And as part of the ISNTD Festival 2024 edition, which I hope you are enjoying so far, I will share with you my thoughts on communicating knowledge. I will share a little bit of my journey with you. I graduated from the medicine faculty of the Autonomous University of Baja California on August 2021. Then I started working as a physician doing inpatient weekend night shifts at Hospital Quirúrgico del Valle in Mexicali, Baja California. And a month later, I began to work as an anatomy associate professor at the university I graduated from. On 2023, I started studying the Master of Science in Biomedicine, and this year I began teaching immunology. Among my interests are infectious diseases, public health, and vaccines. During my social service, I had the opportunity to participate in this study named Report of Adverse Effects Following Population-Wide COVID-19 Vaccination, a comparative study between 6 different vaccines in Baja California, Mexico, which main objective was to describe and compare adverse effects reported during the COVID-19 vaccination campaign in the state of Baja California, where I'm from, here in Mexico in the year 2021. By that year, 2021, the vaccination strategy was structured on 5 stages here in Mexico, where different vaccines were applied as they were arriving to our country and were delivered among priority groups of the population. The reported vaccines adverse effects were from Pfizer, AstraZeneca, Serum Institute of India, Sinovac, CanSino Bio, and Johnson & Johnson. What we were really interested in is to obtain data from our own population to address the uncertainty of how common adverse events were. What people are interested the most in these cases are the severe adverse events. Here, they were defined as an individual that presented one or more of the following in the first 30 days following vaccination. Caused the death of the patient, placed the life of the patient at imminent risk, caused disability or persistent and significant impairment, and or require hospitalization or extended length of hospital stay. Fortunately, among severe adverse events, the rates were low and similar across all administered vaccines, except for AstraZeneca from Serum Institute of India. The overall conclusion of the study, similar to many others around the globe, was that vaccines are a safe preventive intervention. After publishing the study, the world, or let's say the state of Baja California, didn't change, or not so much. And there's when you notice that having the data on a journal or in your database is not enough. It's a tough but satisfactory task, yes, but in the end, you need to deliver your findings with the people so the findings can get real practical value. This makes me think of the philosophical thought that says, if a tree falls in a forest and no one is around to hear it, does it make a sound? Without the intention of creating a debate right now about the physics of sound waves, I think this is applicable to the knowledge that we do not communicate. I think it's not enough to discover new information. We need to transmit to the population so they can follow up on how the science is advancing. Obviously, general population won't be experts on the field, but they need to know what's happening. In my experience, I think people really want to know. They want to receive good information. The photo right here was taken by 2018 on a talk given to a community as part of a class named Comprehensive Community Health, given by Professor Sergio Palacios, a good friend and mentor who passed away due to COVID. During this class, we approached a community who live in adverse conditions, and we taught them about health topics, clarifying their doubts and solving the myths they may have heard about. It was a really great experience that taught me that you can make a change regarding misinformation no matter the number of people. Maybe by communicating correctly, you can change one person's habit and in that way improve their health. It's really worth it. As scientists and healthcare workers, we need to communicate our knowledge in simple and plain language so people can make decisions that promote a healthier life. Sometimes the perception people get from the professionals is that we want them to do this or that. Actually, we don't want to impose our way of thinking. I think that what most of the scientists want is to offer you the information so you can have many options. So based on the explanations of the pros and the cons, you can take the better decision for you, your family, and your loved ones. Once James Hume said, the art of communication is the language of leadership. In that way, we as healthcare workers and journalists could lead society through a well-informed path, reducing the dangers that the attractive misinformation brings. Currently, I am taking part of the ISNTD Cameron Rafik Science Communication internship. I applied for this internship to develop my communication skills toolkit. I'm really interested in research and would love to communicate the knowledge effectively through digital media with people who may be interested. I'm interested in amplifying the reach I can have to help raising awareness among the population to promote a better understanding of health. I truly think people deserve to be informed through evidence-based and easy-to-understand media. Finally, I want to thank you for your time. I am grateful for this opportunity. If you have any questions, I will be happy to answer them.
Thank you so much, Ricardo. It's really amazing to see someone on the scientific side being so engaged and on board with really prioritizing the dissemination of their work. So I'm sure that will be very close to the hearts of those who were talking from the journalistics lens. So thank you very much for sharing your experiences. And this is a great point at which to hand over to our final speaker of the session. Kathryn, you are Kathryn Cleary. You are with Internews, the Internews network that does exactly that, brings together journalists and scientists to facilitate these exchanges and the passing of information. So Kathryn, I'll hand over to you to tell us a little bit more about your organization and what you do, and perhaps also give us some further advice on how to strengthen and improve this collaboration.
Thanks so much, Marianne. Can everyone hear me?
Yeah, we can hear you very well.
Great. And I do apologize. My office windows are open, so if you hear a train noise or an obnoxious motorbike, I apologize for that. But good afternoon, good evening, everyone. It's a pleasure and a privilege to be here on behalf of the Internews Health Journalism Network. I'm very excited to be here. My colleagues are very excited that the ISNTD approached the HJN to be present in this panel. This is something we're extremely passionate about and we're working on every day. My name is Kathryn. I'm the Member Engagement Coordinator for the HJN, as we call it. And today I'm going to share a little bit about how we are fostering hyperlocal health journalism networks from the ground up, as well as championing accurate, evidence-based, localized health and science reporting. You can go to the next slide. Oh, I guess I can click next. I'll click next. Sorry, Marianne.
No problem at all. Whichever works best.
Sure, I'll click. That's fine.
Okay, thank you.
So a little background about who we are. Internews is a massive global media support organization. I like to think of Internews as a labyrinth. We have loads of projects going on across multiple thematic areas. I work in the health space. Internews works with independent media in over 100 countries globally, particularly media that finds themselves in countries and communities where it's very difficult to operate as a journalist. It's very difficult to have access to information. And the HJN, where I come in, was started in 2020 in response to the pandemic. Now, before I joined Internews, I'm trained formally as an investigative health journalist. So when COVID happened, I felt like it was really my time to shine. It was finally when health journalism became cool, it became popular. But at the same time, we then saw journalists who globally were kind of just, they were designed to report on anything, whether it was politics, general news, crime, sports, environment, and everyone was being forced to report on health, which was a very difficult shift for journalists to make. And as a result, you had journalists that were not properly equipped to report on the pandemic. They were not equipped to give their communities the accurate information that those communities needed. At the HJN at Internews, we like to say that information saves lives. But as I was listening to some of my other speakers, you know, information has the power to save lives, but it also equally has the power to destroy lives depending on how accurate that information is, particularly dis and misinformation. The HJN is a global network, not only of journalists, we are health communicators, experts, academics, digital tech, health innovators. We're this beautiful global community of people that really, at our core, we all are extremely passionate about accurate health information. Currently, we have about 1,800 members from over 85 countries, and our membership mostly stems from lower middle income countries, particularly countries and regions that have significant NTD burdens. So what do? We offer reporting resources, virtual events, reporting fellowships, travel opportunities. We try to take journalists to global conferences. Last year, we took a cohort of journalists to the World Conference of Science Journalism in Colombia. I believe it was in Colombia. We have taken journalists to COP for several years. So we really try and find ways to bring journalists to these spaces where these huge conversations are happening with experts. We also work to connect like-minded reporters that are working in similar interest areas to others around the world to foster unique cross-border collaborations. We also do a lot of training of journalists. This is kind of our bread and butter to address the huge lack of training of proper health journalism. Even to be able to go to a journalism school, I was privileged enough to be able to go to university and study journalism for several years. A lot of our members don't have access to that training. They have a very basic phone, they might have internet access, but otherwise you have a lot of community-based journalists, you have a lot of citizen science journalists that are also trying to make sure that their communities have accurate information that's going to improve the health of their communities. So to address this and to fill these gaps, we do a lot of virtual trainings of small networks of journalists in hard-to-reach areas. We've also started developing WhatsApp-based journalism trainings, which is a very new area for us. It's a very exciting area because it allows us to, very easily reach journalists and provide very basic, but still some level of technical training about health journalism. We have an ambassador program where we sort of naturally will find journalists that will start engaging with us at the HJN quite a lot. They'll kind of become our mega fans. They'll email us all the time, and we will foster them and work with them to create their own local network. So a lot of these are kind of WhatsApp groups that then become more formalized, and then you start seeing these conversations. It's really about just fostering conversations. If you look at it at a very basic level, it's about fostering conversations that promote accurate evidence-based science and health reporting. And so we've seen that develop now in Sierra Leone, in Ghana, in Iraq, and in several other countries around the world where we've worked very hands-on with our ambassadors in those countries. Connections to technical experts. I see this has been mentioned several other times by my fellow speakers. Yes, this is something that we also really work hard to be able to do, is to connect our members with technical experts. We're constantly thinking of ideas on how we can make this process easier, because it is something that is extremely hard. Speaking about NTDs, I'm based in Cape Town in South Africa. We did an event earlier this year with Marianne and the ISNTD for World NTD Day, and I thought, I want to know what data South Africa has about NTDs. And I was surprised to find, what I found, which I didn't actually know existed before I had checked. NTDs was not an area that I had reported on previously, and I did not find as much data as I would have liked. And I can imagine, I mean, South Africa has a lot of data in terms of science and health, but in other African countries and other countries around the world, not only is access to data very difficult, but then also linking with access to those technical experts is perhaps even more difficult. So we're constantly trying with our vast Internews labyrinth to make sure that our members can become connected to an expert. And then, as I said, we're fostering those creations of those hyperlocal journalism networks in hard-to-reach areas. Some of our key focus areas, I have missed out a few, so please forgive me. Vaccines is one that I missed out when I was preparing this slide. Infectious diseases and emerging pathogen threats. One Health and zoonotic diseases. I just want to take a second here to really highlight One Health. This has become a huge focus area and even a priority area for us right now, because this really is looking at the nexus of human, animal, and environmental health. So as we have all these ongoing big global discussions about climate change, about zoonotic diseases with COVID, which really shone the spotlight on that, One Health is definitely an area that we are trying to become very involved in, and especially training journalists on how to report effectively on One Health, particularly solutions journalism about One Health. We also focus on underreported and neglected health topics like NTDs, sexual and reproductive health and rights, HIV/AIDS, mental health, health system strengthening, and then mis and disinformation and building trust in communities. Our work on NTDs, I spoke about this a little bit just now. We did an event earlier this year with ISNTD that also included DNDI, RTI International, and other key stakeholders. We had Adenike. Adenike is actually one of our HJN members. We pulled her in for her phenomenal work she's done on NOMA. We worked to connect members with NTD experts around the world. But one of the main things I think that the HJN has noticed with NTDs is we have a lot of members, as I said, in very hard to reach areas. So we have received emails, or we'll get a WhatsApp message from some of our members in these countries that will say, for example, you know, there's an outbreak of Lassa fever in my village, in my community. This organization that I volunteer with, we're doing work on informing people in the community on how to prevent this. But journalists aren't reporting on it, or, you know, the editors don't think it's very newsworthy. So we're also seeing that, you know, the science doesn't sell, that editors are not prioritizing health journalism. So at the HJN, we try and at least give our members a platform to share their stories. We also try and connect them maybe with publications or with editors who provide the training to better pitch their health stories to ensure that that's going to get prioritized. We've also done events in the past on Chagas disease. We have stories that we've done from our members on dengue, Zika, and a key takeaway just with the work we've done on NTDs is that health journalists have a really critical role to play in the fight towards eliminating NTDs. And with that being said, that's my elevator pitch for the HJN. I would encourage everyone that's attending this event, including my fellow speakers, to please join the HJN. As I said, you don't need to be a journalist to join. You just have to have a passion for health and science information. You can scan the QR code here. You can follow us on Twitter, but please do stay connected to us. Thanks so much, Marianne. I appreciate it.
Thank you very, very much, Kathryn. And I have to say that my interaction with Internews, which started at the time of this panel that you mentioned, has been nothing but positive and enriching. This is also how I met Adenike. So it really is a network. It really does work. So by all means, please do consider joining. Well, thank you so much to all our speakers for these amazing insights into the various angles, lenses and facets of the health and journalism interplay. And perhaps whilst we have a few more minutes before the end of the session, I could invite all of you to come back on screen and maybe answer a few questions from the audience, if there are any. If you would like to ask our speakers any question, please do pop them into the chat. And while everyone has a think, well, I think one thing that's really stood out for me, and I was surprised to hear it, was this kind of that science journalism doesn't sell, that it's not prioritized. And of course, we're probably a bit biased here, but I find it hard to get my head around that. And so I was wondering if you had any insights or thoughts about why that might be. I'm not sure if anyone wants to jump in. It seems to me that science, and particular the medical sciences and infectious diseases, are so close to our lives that they would intuitively sound extremely interesting, extremely important for any kind of reporting. But maybe that's just our distorted lens. I don't know if anyone has some thoughts on the matter and would like to go first. If not, we can go in order of presenters, maybe.
I'll comment quickly.
Sure.
And then I'm sure, Trust, I'm sure you'd also want to jump in on this. Trust mentioned in his presentation, in several African countries, well, in a lot of countries globally this year, we're seeing elections. Okay, and I know in South Africa, election news right now, our elections are at the end of May, is front page. You're seeing political news, you're seeing corruption news. And I think, unfortunately, in places where health and science news should be on the front page, you're seeing politics on the front page. And I think this has to do with the high levels of corruption in these countries and how elections and politics really is almost like the lifeblood of these countries. And you have editors that, you're looking at what's going to please your audience most, what's going to make someone go, I'm going to snatch that off the shelf and take it home with me to read it. And it's a headline that's maybe going to say this politician is corrupt or millions stolen by this person. It's not, this is how you can prevent your whole household from getting sick, which really is what it should be. So I'll let other speakers chime in on
that. I mean, just to rehash what Kathryn said, I think, I'm sure in most of these, especially in developing countries, there is relatedness. Well, it's easier to relate everyday struggles with political life, right? So people, if they are having challenges accessing health, or if they have challenges accessing jobs, the easier place to point is at political actors. So I think there is a central role that politics play in public life, and because of that, I think that's why it occupies a central attention for most of the media entities. I think that's the first one. COVID forced a lot of people to consume health news, but other than things like COVID, it becomes peripheral. I think there's other reason why a lot of media organizations don't want to write a lot about science, especially medical sciences, is because of knowledge. So most of journalists don't have knowledge right on science. And because of that, it doesn't occupy a lot of attention in mainstream media. I mentioned in passing that South Africa, and I'm sure Kathryn already knows this, that there's Becky Sister that is focused on health journalism. But other than that, you will struggle to find a dedicated science journalist in any other newsroom. South Africa is actually more advanced. If you go to countries like Mozambique, Zimbabwe, if you say, give me 5 names of health journalists, you'll struggle to find them. A journalist might go and cover cholera outbreak, might go and cover Ebola outbreak, but they are not dedicated science journalists or medical reporters. They're just covering because there's an urgent need for that. But also there isn't also media organizations, they haven't found a way to generate revenue directly from science entities, right? In South Africa, you have organizations like Netcare that can potentially fund pages in a newspapers. But I think the business models currently are not geared towards trying to generate revenue from those entities. And I think that's one area that media organizations, there should be some collaborations between media organizations and health-related businesses that can help bring a lot of science stories into the mainstream.
That's a great point, and also really highlights the fact that perhaps scientists can be much more proactive in terms of reaching out and almost like a briefing to those journalists. I do feel a bit sorry for them because it also seems that the word science, which covers about 1,000 different disciplines, is lumped into one, the remit of one person. And whereas in those same publications, you might have a journalist that does a specific part of the financial markets and someone else who does, household economics and whatnot. So it seems like a big job for one person to cover the moons of Saturn and some detail of vector control in malaria, etc. So some really good insights there, some good points. Ricardo,
Yeah, following the idea that Matsilele was commenting, yes, by hearing science, the general population will say, yeah, science is rich, there's a lot of money in science, but I think that is true, but for the commercial science, like obviously the ibuprofen industry, the acetaminophen industry, there's money there, but those are the products that are already in the market. But for the basic science, for the developers, for people that are doing research in laboratories, doing their PhDs, postdocs, there's not so much money or support in comparison to this big pharma industry. So I think that maybe one of the reasons that maybe these researchers don't get the support that they will want to receive is that for a country is like they think this in this way. Maybe the money that I'm investing right now, it's not gonna come right after in a year or in 2 years. So maybe we won't give too much money to these researchers. But at the end, it's an investment for the long term. So like countries that invest too much in science, like the ones that get the most Nobels, like they know that it's a really good investment. The pharmacy company that is supporting these researchers or these students at some time will get a result, and that result will bring money and development for the country. You're on mute, Marian.
Yes, I was in while you were speaking. I forgot to put my mic back on. Adenike and Aline, did you want to add anything to that?
Yeah. Hello, can you hear me?
Yeah.
Hi, Miriam, can you hear me?
I can hear you. Yeah, we can hear you really well.
Okay, sorry, I missed your call. Yeah, I missed the question. Sorry.
We were just pondering on the fact that science news doesn't sell. Is it because it doesn't sell? Is it because other issues always tend to take the lead? And what might be some of the reasons behind that? Have you found that in your own experience that this it's not prioritized?
Yes, actually, an event I'm attending today, I'm actually still there. I went out there to give my presentation. We still spoke about it about 2 hours ago, that health news don't sell. And it's not just in Nigeria, in most parts of the world. And you won't blame them. It's not their fault. People focus more on politics. Apart from the fact that we're trying to advocate for change, we're trying to create awareness, let people know, and be advocates in different ways. The importance of funding, the importance of money, the importance of finances cannot be taken away. So these media houses need the finance, they need money. And what brings them money is politics. Do you understand? So they focus more on politics. However, you give it to media houses. Unlike 2 to 3 years ago in Nigeria, you hardly see any news platform focusing on health. But now, as of last year, this year, it has really improved. People are really pushing more attention towards health, unlike in previous years. So let's just give it to them. Probably with time, we'll record more success, yes. But it has really improved from the way it used to be. Before, you could just see like one news health story in a week. But now, news agencies are really topping up their game. And even the event I'm attending today is about health, and you see the stories everywhere. So there have really been improvements. So we have to give that to them.
Fantastic. Well, that's good news. And how interesting that that same topic was being discussed on the other side of the world exactly 2 hours ago. It's definitely a running theme. Thank you, Adenike. Aline, would you like to add to this?
Yes. Can you hear me? I'm sorry. Okay. So I think during the surveys I showed in my slides, I think people, like Ricardo said, they want to know, they want to seek information about health, and even if that idea that science doesn't sell, I think during the pandemic, since the pandemic, it has been changing a lot. I've never seen so many scientists and physicians on TV as I'm seeing right now. So I think little by little, science and health, these topics are occupying their space in the media. But of course, we need to keep moving, and we need to keep reinforcing the importance of this kind of information.
Yes, fantastic. That is true and a very good point. And someone in the chat added, Rod Dillon, thank you for commenting. Rod was adding that I'm not surprised that science doesn't sell, and it doesn't help that very few politicians are scientists. That's a really important point. So more and more scientists on TV, that is true. I do think there is a growing movement amongst the public for better understanding of science. But I have 2 syllables to ask about at this point, and that is TikTok. So where are people getting their science news from? Maybe it's not so much that science news doesn't sell, but that people are not turning to those conventional news sources for their information. It's an open question.
I think that, sorry, I think really the journalism have changed a lot, and people are more and more people are using social media and TikTok, and probably other new social medias will come, like TikTok did. So at the same time that people are getting more interested about health and science, they also want the information to be short, to be direct, to be like a minute or 2 minutes. They don't have time, or they don't want to spend time reading a big article or something. But I think at the same time we need to continue to have this writing articles and having the complete information. We also need to adapt to the new this new era of social media. So try to find ways to be present in Instagram, in TikTok, to talk to young people because young people usually don't listen to the radio. Young people usually don't watch TV anymore, read the newspapers or anything. So I think we need to start populating this zone, so we can reach these people, especially young people.
I'll probably just say it's good to have these social media affordances. And yes, you reach this young demographic group. The challenge, though, with social media, because there are no filters, right? Everyone is a scientist. Everyone is a science journalist. Everyone is an expert. Kathryn will probably remember one of this fake doctor in South Africa who was giving recommendations on TikTok, right? So, because in these spaces, no one gets to verify credentials. And what does it say, especially if you want to give access, you want to give credible information to the public, which is the right source. So there's one element of, a lot of deep professionalization that happened in these social media applications. But of course, with the rise of the far-right movements, 2016, now you also have conspiracy playing a central role, especially in science. There are a lot of historically credible journalists who also became discredited or discredited themselves because of the conspiracy that we started seeing post-2016 going into COVID pandemic. So again, if these voices don't have platform in the mainstream spaces, they continue with their conspiracy in alternative media, like social media, X, Farm Social, and every other platform that is willing to give them voice. So I think those are also challenges that comes with these platforms here.
It sounds like a minefield out there. Would anyone like to also comment on science news, health news, and social media?
Go ahead, Ricardo. Go ahead.
Okay. This lack of credentials is a really big issue because, for example, the scientists, or I will talk about myself, I feel like a little bit stopped by the fact that whatever I say, I may be accountable for that. Because, well, that's the way I work. If I prescribe a medication to someone, I'm responsible for the treatment. But in social media, that is not the fact. It doesn't work that way. You can say whatever without being accountable. That's what I have seen in Twitter, Facebook, TikTok, etc. So the people without credentials are more. It's really difficult for young people to regulate or to validate or to analyze who is the good source of information. And the people with credentials, I include myself, we don't want to sell science. We don't want to sell science. We are bad sellers, let's call it that way. We don't know how to approach to the young people. So I think that's the issue. That's why I'm here at the internship.
Just one last thing to add to that, as I think we all have, said, social media in terms of health and science information is really like the Wild West. It's very poorly regulated. You have people dressing up in lab coats in studios pretending that they're doctors, which is exactly the incident that Trust was speaking about. This was literally some random guy. He was sneaking into hospitals to film his content. He did actually get arrested. But I mean, it's ridiculous what people will go to try and forge credibility. But what I wanted to highlight is it's something that we have included in a lot of the training work that we've done with different groups. We've done trainings with faith-based leaders. We've done trainings with journalists, with CSOs, is not only about how to identify health misinformation, health and science misinformation, but also how to fight against it and how to stop it. So we've all seen WhatsApp messages, Telegram messages, forward this 110 people, this is something that's happening. You have to cut off those information chains You also have to know on social media, this is one of my favorite things to do. I go on Instagram because it's my platform of choice. I find all these dodgy health and science accounts and I report all of them. And, I think something that we need to encourage people to start doing, and especially young people love social media. You do have the ability to take measures to control the information that you're seeing. So if you see something that is inappropriate, that makes you uncomfortable, that you suspect is fake news, Meta does have people employed to check these things out. They do have fact checkers, which is a great development. So, I would encourage all of us to keep that going, that, social media isn't going anywhere. I'm not even on TikTok. I don't even know how to use it. It's not my forte. But, we need to make sure that young people and that experts like yourself, Ricardo, understand that if you see something where you're like, this isn't right, I know within my medical expertise that this isn't correct, that you can report it, and we can try and at least have some sort of regulation in that space to make sure that we are actively health myths and disinformation.
That is great advice. We can all have a role to play. And it's great that you've mentioned misinformation, because the question has come up in the chat from Steffi Lowe. Thank you, Steffi. You are asking, in terms of mistrust and misinformation, mistrust is what you've asked about in the question. Is there a difference in the way that mistrust comes out between the global south and the global north? Are there different issues? Does it appear in different ways? And if so, how could this difference come into play in scientific reporting? Does anyone have experience of that? Steffi, you've asked a great question. Maybe some of the, if anyone has insights into what maybe is more of a burning issue in the global north versus the global south in terms of health reporting, misinformation. Interesting. That's given us a lot of food for thought, Steffi. Thank you.
I'll add one comment here, and then I'd love my other speakers to join in. So something that we have seen with the HJN and locally, what I've seen here in South Africa is that people tend to, if we're talking about mistrusting the media or if we're mistrusting science, I think this fits into both categories, is that, when you look at a country like South Africa, for example, that has indigenous health practices or indigenous medicine beliefs, you're looking at competing systems, right? You're looking at a competing indigenous health system with a competing Western medicine system. And I think when you have a media that is not including those voices that should be included in reporting from traditional leaders about their beliefs and their cultural practices, those need to be validated and those need to be balanced in local media. I think in South Africa, for example, when we don't see that happening, I've been in communities firsthand where communities say, no, I'm not going to go talk to that journalist because they don't care about what I have to say. So that would be my insight into that.
Thank you.
Yeah, I won't be able to answer directly to Steph's question, but there's certainly a diffusion of misinformation, and I think that became so evident during COVID pandemic that a lot of mistrust that was coming from the global north would easily have a foothold in the global south. Especially if you look at the religious entities. So if the far-right movement, religious entity in the United States is driving some conspiracy theory around COVID pandemic, it would easily permeate into some societies in the global south. So I think that power dynamics still play a role even in the movement of misinformation from the global north to the global south. You seldom see misinformation moving the other way. You know, it's really around power differential. So yeah, I think these synergies certainly exist around misinformation and mistrust.
Very good point. And there's probably quite a bit of mistrust by the global south of the global north, but that's another conversation. There's a great resource that's been shared by Denise Van Riesen. Thank you very much. On the topic of health misinformation, Denise is recommending a course, a free course on the WHO's website. It's the Open WHO course on health in misinformation. Thank you for that. The link is in the chat. Well, we had a lot to cover in these 90 minutes. Big topics, big themes, quite substantial challenges, and I feel like we learned a lot from our panelists. I'm sure the audience will agree. We're sort of coming up to the end of our allocated time. We're really grateful that you've been able to join us for these 90 minutes. Thank you so much. Perhaps it is time, if there aren't any more questions from the audience, to bring this session to a close. Just before we do that, if anyone has some final words or final suggestions, perhaps a call to action in terms of bringing communicators and scientists closer together or improving that relationship, the floor is yours, please. If anyone has parting words, we would love to hear them before we say goodbye.
Nothing to add, but it was a pleasure to share the screen with you.
Thank you, Ricardo. Same, absolutely.
Yeah, I think I would say it's important for people like Kathryn who have some form of influence in media organizations, to create platforms for people like Ricardo who are experts, to either maybe to write opinion articles in some of these media organizations. A lot of media organizations run with skeletal budget, they have skeletal staff, and they would take free content given an opportunity. So I'm sure experts like Ricardo can leverage their experience to help spread science knowledge for free.
Thank you for the advice.
That's great. I'm sure the scientists would also enjoy the added exposure to their work as well. So any more concluding words of advice? No? Okay, well then all that's left to do is for me to thank you again very much for your time and your invaluable input into this session. Thank you to the audience. I especially would like to say extra special thank you to Aline and Ricardo, who, as you may have heard, are the ISNTD Science Communication interns. So thank you for all your work on the festival, and well done. You did it. Congratulations on your panel. Internews and Adenike, it's been wonderful to meet up with you again following our panel earlier this year. And Trust, well, what can I say? It's a pleasure meeting with you. I hope we can collaborate again in future. We've learned so much from you, and I feel like it's such a dynamic topic, a field in movement, and we have many more opportunities to reconnect, I hope. But in the meantime, another very big thank you, and all the best from us here at ISNTD. Until next time.
Thank you so much, everyone.